is our live session to celebrate our anniversary. Now, actually, anniversary might be a little bit confusing with the Venkat Center because in a way, this is two anniversaries. Venkat Center was first started by Dr. Venkatram in 2003, and at that time it was Venkat Charmalya, and it was purely a skin-based center. Then we opened two more centers, one in Cunningham Road, one in Banshankari, apart from our original one in Vijayanagar. In 2018, I joined the center and we started plastic surgery, as well as Dr. Deeksha joined the center and we started ENT services. And this is the fourth anniversary of that. So it's a 19-year anniversary of the center as a whole, fourth anniversary of the full Venkat Center, Venkat Charmalya becoming Venkat Center. Dr. Venkatram is going to tell us a little bit about his journey and what caused him to start this center and how it has grown.
Till 2003, for almost 13 years, I was abroad. Earlier to that, I had worked in the armed forces and then went abroad after my MD. And then we had an urge to come back to motherland and start a well-equipped dermatology, dermatosurgery center. So in 2003, me and Dr. Jayashree came back. We started the center with several new initiatives which were novel at that time. We started with follicular unit transplantation and microscopic dissection. We started with targeted phototherapy and dermatopathology. And very soon we added tumescent liposuction, totally under local anesthesia, after Dr. Jayashree underwent training with father of modern tumescent liposuction, Dr. Jeffrey Klein. And then the facility grew leaps and bounds, attracting patients from all over the world, trainee doctors from all over the world. And we added other facilities such as thread lift, different types of phototherapy, allergy, etc. And then, of course, we got recognized by the Rajiv Gandhi University of Health Sciences for the fellowship in aesthetic dermatology. At that time, the first private center to be recognized. And then Dr. Aniket joined in 2017. We added plastic surgery. By this time, we had a good collection of lasers. We were doing all kinds of dermatosurgery. And then with his entry, we added rhinoplasty, breast surgery, abdominal surgery, facelifts, etc. Then we had Dr. Deeksha joining us as a head and neck surgeon, allergy specialist, lasers for snoring specialist, and now we have multiple specialties. We also had a charitable wing with Shraddha Clinic, etc. Now we are here, 4th anniversary of Venkat Center, 19th anniversary of Venkat Charmalya.
So, if you have any questions for us, do let us know. We will answer them during this live session, apart from the other things that we're planning to go over. Now, one thing at the Venkat Center that we always wanted to do was to make sure that we don't just cater to a certain section of society. It's not that cosmetic surgery is only for wealthy people. We wanted to be able to serve everyone. Even anyone can suffer from gynecomastia. Anyone can suffer from baldness. These are things that we wanted to treat for everyone. So for those reasons, we have always tried to cater to all sections of society, and for that, as Dr. Venkat mentioned, we have our Shraddha Clinic, wherein every day from 8:30 to 9:30 in the morning, we see anyone at very nominal rates, irrespective of their background, and even their procedures are done at a reduced cost. Apart from this, another thing I'd like Dr. Venkat to speak about is regarding last couple of years, how COVID has been and how we were able to navigate that period.
COVID was a hit for everybody in the world, so it was for us. But we had innovations. We offered free online consultation for the first month. It was something unique. We didn't charge anything for online consultation. Then patients were demanding different types of treatments. At the same time, we had to safeguard both the patients as well as the staff and doctors. So we made several innovations, including a kind of a food to restrict the breathing of the exhaled air of the patients. We published these. We had almost 5 papers on COVID precautions in dermatology. We helped in the formulation of guidelines. And with this, we coped up with the stress of COVID And of course, once COVID was subsiding, we started our full facility. Now we are almost back to normal. Now, one of the things that we have always stressed is teamwork. See, current day medicine is not like one doctor seeing for everything and everybody and every time. It is about teamwork, and this is something which is unique. You will find us. For example, we have a combination of dermatologists and plastic surgeons doing different types of surgeries in the skin and hair transplantation. Dr. Aniket is an expert in FUE. And then we have a unique combination of a male and female liposuction surgeon, Dr. Aniket and Dr. Jayashri. You will not find this combination anywhere in the world. We also have a head and neck surgeon assisting in hair transplantation and also in rhinoplasty. So for rhinoplasty, you have a combination of plastic surgery and ENT surgeon. Again, a very unique and very special combination of great benefit. Likewise, we have allergy, skin allergy and ENT allergy. We have dermatopathology. And so like this, the emphasis is on teamwork in almost everything. So if there is help needed, there is always another person to give help in terms of technical expertise and experience. That is why we say our motto is experience, ethics and expertise.
Now, I'm just going to take you around our facility and we're going to see all parts of it. Plus, I'm going to talk a little bit about what are some of the new things we have done in the last year. So, one of the big things that we have introduced is something called migraine surgery. Now, this might seem as something very counterproductive. People might think that migraines are headaches which are treated only by medicines. How can you do surgery for this? But we're one of the first people to introduce this, wherein a lot of people with migraines, they have small nerves on the outside of their face which trigger the migraine. And if you block those nerves, if you release those nerves, migraines aren't as severe. As far as we know, we're the first people in India to start this, and we hope that a lot of our patients can take benefit from this. Apart from this, another thing which we have introduced is 3D imaging for our patients. Now in this, what we have done is, we have partnered with a company called Chrysalix, which enables us to make 3D models of all our patients. And this helps them see, one, it helps them see what issues they have, and it helps us discuss properly about what we can achieve with surgery. And secondly, it also gives us an idea about what results can be done for certain procedures. For example, for breast augmentation, you can see how a particular implant can look on your specific body type. And this can help you take a decision on whether the surgery is right for you or not. Apart from that, let us go over the rest of the clinic and we'll see some of the things that have been introduced in the past 1 year. So, moving through the clinic, here we have Dr. Diksha Rao, our ENT surgeon. How are you?
Hi, I'm good.
So, can you tell us a little bit about what it is that you do, what some of your specialities are?
So, apart from routine ENT, which I see as OPD, I've done a course in allergy. So, we've started a new treatment, that is immunotherapy for a lot of patients suffering from allergy. Other than that, we have a laser procedure for snoring, where we tighten the tissues in the throat and reduce the intensity of snoring. And I'm also doing a vertigo course, which I'll be finishing this month, and hopefully we'll be able to assess and treat vertigo patients very well from now on and help to rehabilitate them.
Along with all this, we also hope she'll be doing more YouTube videos from now. So, expect to see her up in the coming years. Thank you.
Thank you.
Now, this is our waiting room, and these are our staff. For anyone who tries to take appointments with us, these are the people who make it happen, and they guide you through every step of the way. Say hi, everyone.
Hi.
Now, moving into the operation theatre area. This is where we do our procedures. We have a couple of patient waiting rooms. We have a dressing room wherein we do all our dressings after any kind of surgery. Moving into the operation rooms, we have two operating theatres, one hair transplant theatre and one liposuction theatre. This is the hair transplant theatre. This is our sister Kalpana. ಹೇಗಿದ್ದೀರಿ?
Fine, sir.
ಸಿಸ್ಟರ್ ಕಲ್ಪನಾ ನಮ್ಮದು ತುಂಬ ಲಾಯಲ್ ನರ್ಸು, ಮೊದಲಿಂದ ಇದ್ದಾರೆ. ನಮ್ಮ ಓಟಿ ಅವರಿಲ್ಲದೆ ನಡೆಯಲ್ಲ. ಆ್ಯಂಡ್ this is our in-mode machine, which is again something that we have introduced in the recent future. So this is basically a non-surgical skin tightening machine. What it does is we make a small hole and this needle-like thing goes under the hole, and this part is outside the hole. So it passes heat energy from inside to outside and it heats the skin, and this helps to tighten the skin. So what this does is it helps us to avoid scars in some patients. For example, someone who does not require a full facelift, someone who's got a little bit of sagging doesn't require a blepharoplasty, someone who's got a little bit of extra skin in the tummy who doesn't require a tummy tuck. In all these patients, this machine can tighten the skin without the need for a full surgical procedure, without the need for a big scar. Now, as I was saying, this is our hair transplant OT. We do both FUT and FUE in this OT. We're one of the few centers to offer both these techniques. We believe that the right technique should be done in the right patient. There is no such thing as only FUT should be done or only FUE should be done. Obviously, most patients prefer FUE. No one likes the idea of having a scar on their head. But in some patients, FUT is required, especially when you need a huge number of grafts, 5,000, 6,000 grafts. In such patients, if you try to do only FUE, then you'll end up creating a very bad donor area. So for those patients, FUT plus FUE is what gives you the best result. Now, moving ahead, this is our other OT, our general anesthesia OT. That is our brother Kiran. Hegidire? So this is our general anesthesia station, our brand new cautery machine. And this is the exciting new machine that we've introduced just a couple of months ago. This is our piezotome. So this is a machine that helps us to make very fine, very precise cuts in bones during rhinoplasty. So in rhinoplasty, this upper part is all bone. So if you want to make that look better, we have to make cuts and move it around. Before we used to use a hammer and chisel. Now those are not bad tools, but they have their limitations. With this machine, we can make very precise work, very fine bony work, and this helps us give a better result for our patients. So this is another exciting thing that we have introduced in our center. So this is a brief overview of our facility. We believe in patient safety above everything else. For all our surgeries, even under local anesthesia, all procedures are evaluated before we start operating. So we only take patients once they are fit for surgery. And then during surgery, there are all backups to make sure that the patient's safety is not compromised. As we said, expertise, experience, and ethics. And it is because of this that we're also able to have several innovations. So for example, we're one of the few places in India doing liposuction almost entirely under local anesthesia. And many people find this hard to believe. They don't understand how liposuction can be done only under local anesthesia. But that is our specialty. It was first learned by Dr. Jayashree many years ago, and then I started it from her. So with the advantages with this is, one, you don't have any risk of general anesthesia. Two, you're back to work very, very quickly. And three, we can make you stand up in the middle of the surgery, see how you're looking, make you lie down, do some more. So this way, the result can also be better. And there has been a lot of talk in the last few months that a patient died under general anesthesia. Now, without going into the details of that specific case, local anesthesia is the safest way to do liposuction. And that is why we prefer it. So now we're going to come back with Dr. Venkat. We're going to talk about a few more things. As I said, if you have any questions, do not hesitate to ask them. So Dr. Venkat, can you tell us a little bit about what our future plans are going forward?
Future plans are, of course, to grow from what we have done so far. And that means to establish a large center which has all these facilities in one roof, and to do more in these areas. More for patient care, more for academics, more for research, and more for the community. So the construction has started to build a large, nearly 18 to 20,000 square feet structure, not far from here, about 5-6 kilometers in Bangalore. It is right on the main road, very easily accessible, and that will be a unique center which offers dermatology, cosmetic dermatology, plastic surgery, cosmetic surgery, women's health services, ENT services, everything in one roof. It will also continue the training with fellowships in different fields and activities in research. We will not lose sight of our commitment to the society and continue to strive for providing affordable health care to poorer sections of the society. This is the plan. Hopefully, in about 1 year, 3 months time, by sometime next year around this time, we should be able to do that.
Now, our center is unique in the sense that it's one of the few places where you get skin, you get dermatology, and you get cosmetic surgery along with ENT and women's health all in one roof. But a lot of our YouTube subscribers are hair patients. The bulk of our YouTube growth has happened from our hair patients. Now, being that Dr. Venkat is one of the oldest hair transplant surgeons, not in terms of age, well, that also may be, but in terms of experience, I thought we'll just take this chance to ask him some questions about his hair transplant journey. So, what made you get into hair transplant, and how have you seen the field evolving ever since you started?
See, hair transplant surgery took a big leap around 96 to 98, when this technique of follicular unit transplantation with single strip excision, dissection under stereo microscopy, performance of mega sessions, and higher density was introduced with large teams. And then I learned it in different countries. I went to Korea, I went to America, Australia, then of course Israel. Dr. Alex Kinberg came here. So with the result that we established ourselves as a pioneer in this. And then FUE got introduced 2006 to 8. It took a few years to establish itself, and that also we introduced. Body hair, our paper is one of the first papers on this. And then when Dr. Aniket came in, the technique of FUE went one step ahead because he is a real expert in it. And now we have a team of 3 hair transplant surgeons with me, dermatologist, Dr. Aniket, plastic surgeon, Dr. Diksha, head and neck surgeon. This is a unique combination which you will not find in many centers. Plus we have a team of nurses who are there with us for a very long time. All along the way, we wrote a book on hair transplantation, the first book in India on hair transplantation. We published over 30 to 35 papers in the field of hair loss and hair transplantation. And we continue to work for formation of guidelines. One of the things that has happened is entry of quacks and black marketing in hair transplantation. FUE made it simple and removed the fear of surgery from the patient's mind, and not just patient's mind, even an assistant's mind or a surgeon's mind. So anybody and everybody is having a go at it, whether they have a qualification or not. With the result, we have heard of horrible incidents of blindness, severe infections, even death. 4 deaths so far in the world, 4 or 5 deaths so far in the world. To such an extent that the High Court in Delhi now has ordered the government of India to formulate guidelines as to who can do it and who should not do it. We are actually fighting that case, and we are representing the government. And hopefully this field will get streamlined with establishment of proper guidelines, which we have already framed. We have written 2 guidelines, one for Dermatology Association and one for Hair Restorations Association. And through proper training, webinars, we keep doing webinars. With that, the hair restoration will be done in a way that it should be done. It's a simple surgery, but it is not a trivial surgery. And surgery is a surgery, however simple it is. It can become complicated if those who are not qualified try to do such surgeries. So my request to patients is, you are all very aware, you are all very savvy, internet savvy. Information is available. Use it to get the best information and go to the right person. Cost should not be the only factor in cosmetic surgery. You are not trying to save life here. You are trying to look better, and that often comes at a price. So if the person is experienced, if he has the expertise, he will charge you a little more than somebody who doesn't even have a medical qualification. That doesn't mean that you can get a hair transplant done by a carpenter or a SSLC person. That is what happened. People have been arrested that they were doing surgery when they had no business to even get into the operation theatre. That is what is called black marketing in hair transplantation. Please don't do that. It should not be reduced to the level of a salon. It is a surgery, extensive surgery with many, many ramifications.
Also, one thing unique to the Venkat Center is Dr. Venkat's teaching program, which is a fellowship program accredited to the Rajiv Gandhi University. Can you tell us a little bit about what led you to do this? It's rare for a private institute for a private practice doctor to be involved in teaching as heavily as you. Why did you start this?
This is something which we are very proud of. As Aniket mentioned, it is not usual for a private institute to do it. And here again, we were a bit of pioneer. The simple reason is that knowledge should be shared, and we needed a vehicle to share the knowledge. And dermatology, cosmetic surgery is a field wherein a single institute can do almost everything. So, with the result that our center is better than most medical colleges in terms of these kind of facilities. So, we have dermatopathology trainees, we have clinical dermatology trainees, aesthetic dermatology trainees, hair transplant trainees, trichology trainees, laser trainees. They come from all over India and around the world. So that is something which we have been doing. At any given time, we have at least 6 to 8 trainees in our center. We have a team of qualified dermatologists also, and that helps us to give the latest care, because education also means access to latest information. And we have a bunch of young doctors who are enthusiastic, keen to learn, and keen to provide service to patients. And that is a unique setting. It's a very nice experience to be working in a center like this, and we are very proud that we could establish that.
Now, the other thing that I would like to say is that when we started this YouTube channel, we had no idea about how many subscribers we'll get or anything like that. We have crossed almost 7,000 subscribers now, which we are very thankful for. And we want to thank all our subscribers for tuning in. Our main aim has always been to provide information to educate our patients so that they can take an informed decision. We saw that as YouTube was getting more popular, that there was a lot of misinformation, downright lies in some cases, that were present all over the internet. And we were worried that this would affect patient care. We were worried that people would take wrong decisions and have bad outcomes because of this. So that was one of the main reasons why we started this YouTube channel, to educate and inform our patients, and we're happy that our efforts have been well received. In addition, our channel, we are one of the few channels giving Kannada content because we want to reach everyone. So for Kannada viewers, Dr. Venkat will say something.
Kannada, of course, is our mother tongue. So I will speak now in Kannada this part. ಕನ್ನಡ ನಮ್ಮ ಮಾತೃಭಾಷೆ. ನಾನು 2003ರಲ್ಲಿ ಈ ಭಾರತಕ್ಕೆ ವಾಪಸ್ ಬಂದಾಗ ಮೊದಲನೇ ಕೆಲಸ ಮಾಡಿದ್ದೆ 2004-5ರಲ್ಲಿ ಕನ್ನಡದಲ್ಲಿ ಚಿಕ್ಕ ಚಿಕ್ಕ 3 ಕಿರಿ ಪುಸ್ತಕಗಳನ್ನು ಬರೆದೆ. ಇದು ರೋಗಿಗಳಿಗೆ, ಪೇಷಂಟ್ಗಳಿಗೆ ಚರ್ಮದ ಬೇರೆ ಬೇರೆ ಕಾಯಿಲೆಗಳ ಬಗ್ಗೆ, ಬೇರೆ ಬೇರೆ ಚಿಕಿತ್ಸೆಗಳ ಬಗ್ಗೆ ಮಾಹಿತಿ ಕೊಡಲಿಕ್ಕೆ 3 ಪುಸ್ತಕಗಳನ್ನು ನಾನು ಪಬ್ಲಿಷ್ ಮಾಡಿದೆ. ಈ ಪುಸ್ತಕಗಳನ್ನು ಕರ್ನಾಟಕ ರಾಜ್ಯ ಸರ್ಕಾರದ ವತಿಯಿಂದ ಅನೇಕ ಲೈಬ್ರರಿಗಳಿಗೆ ವಿತರಿಸಲಾಯಿತು. ಅದು ಇಲ್ಲಿ ತನಕ 3 ಎಡಿಷನ್ ಆಗಿದೆ. ಇದು ಜೊತೆಗೆ ನಾವು ವೆಬ್ಸೈಟ್ ಕೂಡ ಮಾಡಿದ್ವಿ. ಈ ಸೋಷಿಯಲ್ ಮೀಡಿಯಾ ಬಂದ ಮೇಲೆ ಇದರ ಮೂಲಕ ಮಾಹಿತಿ ತಿಳಿಸೋದಕ್ಕೋಸ್ಕರ ಕನ್ನಡದಲ್ಲಿ ವಿಡಿಯೋಗಳನ್ನು ನಾನು ಪ್ರಾರಂಭ ಮಾಡಿದೆ. ಕನ್ನಡದಲ್ಲಿ ಜಾಸ್ತಿ ಮಾಹಿತಿ ಇಲ್ಲ, ಆದರೆ ನಾನು 13 ವರ್ಷ ವಿದೇಶದಲ್ಲಿ ಇದ್ದರೂ ಕೂಡ ನನ್ನ ಕನ್ನಡ ಪ್ರೇಮ, ಕನ್ನಡ ಭಾಷೆಯನ್ನು ನನ್ನೊಳಗಡೆ ಜೀವಂತವಾಗಿಸಿತ್ತು. ಹಾಗಾಗಿ ನಾನು ಕನ್ನಡದಲ್ಲಿ ಇದನ್ನು ಮಾಡಲಿಕ್ಕೆ ನಾನು ಇಷ್ಟಪಡ್ತೇನೆ. ಅದು ಹೆಮ್ಮೆಯ ವಿಷಯ ಕೂಡ. ಹಾಗಾಗಿ ಸಾಕಷ್ಟು ವಿಡಿಯೋಗಳನ್ನು ನಾವು ಕನ್ನಡದಲ್ಲಿ ಮಾಡಿದ್ದೇವೆ, ಆ್ಯಂಡ್ ಅದು ಸಾಕಷ್ಟು ಜನರಿಗೆ ತಲುಪಿದೆ ಕೂಡ. ಈಗ ಉತ್ತರ ಕನ್ನಡದಿಂದ ಪೇಷಂಟ್ಗಳು ಬರ್ತಾರೆ, ಅವ್ರಿಗೆ ಇಂಗ್ಲೀಷ್ ಎಷ್ಟೋ ಕಡೆ ಬರದೇ ಇರಬಹುದು, ಆದರೆ ಅವರೆಲ್ಲ ಈ ಕನ್ನಡ ವಿಡಿಯೋ ನೋಡ್ಕೊಂಡು ಬರ್ತಾರೆ. ಎಷ್ಟೋ ಜನ ಅದನ್ನು ಹೇಳ್ತಾರೆ, ಮೆಚ್ಚಿದರೆ ಕೂಡ, ಯಾರೂ ಮಾಡಲ್ಲ ಸರ್, ನೀವು ಒಬ್ಬರು ಮಾಡಿದ್ದೀರ ಅಂತ ಹೇಳ್ತಾರೆ. ಇದು ಬಹಳ ಬಹಳ ಮುಖ್ಯ. ಹಾಗೆ ಈ ಥರ ಕನ್ನಡ ವಿಡಿಯೋಗಳನ್ನು ಬಾಕಿ ವಿಷಯಗಳಲ್ಲೂ ಕೂಡ ಮಾಡಲಿಕ್ಕೆ ನಾವು ಪ್ರಾರಂಭ ಮಾಡ್ತೇವೆ. ಸೊ ದಿಸ್ ಇಸ್ ಎ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಇನಿಷಿಯೇಟಿವ್ ದಟ್ ವಿ ಪ್ರೊವೈಡ್ ಇನ್ಫಾರ್ಮೇಷನ್ ಇನ್ ದ ಲೋಕಲ್ ಲ್ಯಾಂಗ್ವೇಜ್. ಆ್ಯಂಡ್ ಅಟ್ ದಿ ಸೇಮ್ ಟೈಮ್ ಐ ಆಲ್ಸೋ ವಾಂಟ್ ಟು ಮೆನ್ಷನ್ ಹಿಯರ್ that we get trainees from all over the world, and at any given time our doctors and staff are able to speak at least about 8 to 9 languages. In fact, right now I can tell you that we have a doctor from Delhi, we have a doctor from Jharkhand, we have a doctor from Uttar Pradesh, we have a doctor from Orissa, Andhra Pradesh, Malayalam, that is many nurses are from Kerala, and then we speak English and Kannada and Hindi. So that means there were 9 languages already. And if you wish a little more information, we can speak a little bit of Arabic too, having been in the Gulf area for quite some time. So this has always been one of our efforts to communicate as much as possible in the local language.
And lastly, we're close to winding up, but we've always gotten a few questions on our YouTube channel which I would like to address now. One thing is we get a lot of questions asking why we don't show more surgery videos from inside the operating theatre. We don't do that usually because one, we want to be focused in the surgery, and two, we respect the patient's wishes. Every single piece of content, every single photo that you see on our channel has been done with the patient's written consent that they have agreed to share their photos. So we appreciate all our patients who have agreed for this, who allow us to use their reviews, their testimonials, their photos for the case of education. In many cases, they have actually had a bad result somewhere else and they come to us and they agree for the video because they tell us we don't want someone else to go through this. That's why we want to educate other people. So we're very thankful for all such patients who agree for this. And stay tuned to our YouTube channel. We'll keep producing videos. We'll keep trying to improve the quality of our videos. Your suggestions are always taken on board. Even if we don't, if you make a suggestion, you might not see that video the very next week because it takes some time. But do understand that while we might not be able to respond to every single comment, we pay attention to every single comment and we keep track of what kind of videos our patients are asking for, and we do our best to cater to them. And lastly, it's been a 19-year journey, and this would not have been possible without all our staff. You might see just me and Dr. Venkat on YouTube most of the times, but for the center to run, there's a whole team of people behind it, in the front office, from our nurses down to our cleaning staff and our ayas, our OT boys and technicians. And the center requires all of them to function properly. And Venkat Center would not be what it is right now. And we hope to keep going higher and higher and bringing our services and our expertise to as many patients as possible.
I agree. And along with this, my sincere thanks to all the patients, staff, colleagues, doctors, trainees, and patients and staff, everybody. One of the things that we have always laid stress on is the ethical practice. We keep hearing complaints about exploitation, wrongful advice for surgery, exaggerations, etc. We have shunned away from all of that. If in a hair transplant 1500 units is enough, we will only tell 1500. We will not put 2500 hairs, where 1500 will be enough. And likewise, whether it is in the calculation of grafts, whether it is in the liposuction result, whether it is in the laser result, in everything, ethics, consideration of patient feedbacks, integrity, these all play a major role. That is why our motive is experience, expertise, and ethics, and that is very important. I hope that you will continue to follow us on YouTube and other social media. I hope you have liked this presentation. We will continue to keep coming back to you on different occasions and different topics. Thank you very much. Good luck to everybody.
Thank you. Have a good day. And this is the first time we've done a live session. If you like this, do let us know and we'll try to do it more often. Thank you so much.